So welcome and thank you. I look forward to working with you. Today we do have Senate file number 1 on the agenda. And so Senator Benson.
Thank you, Mr. Chair and members, for welcoming me to your first committee of this 90th legislative session. Senate File 1 is in response to something that we all have talked about over the past several months. In July, Blue Cross Blue Shield left the individual market, and we all knew at that time there was something wrong with our individual market. Many of us expressed shock at premium increases of 50 to 67% as they were announced this fall. Our friends, neighbors, local business owners, and even family members told us of the worry they felt paying their insurance premiums or having to choose not to pay their mortgage. As these rates have increased, more people have enrolled in MNsure. They announced that they broke 100,000 in their latest enrollment measurements. Those individuals have access to advanced premium tax credits. However, there's a large category of people who are not eligible for advanced premium tax credits. They are impacted, their businesses are damaged, and there's no relief available. In October, Governor Dayton proposed just over $300 million in premium relief for the individuals in the middle of this market. Many of us supported that, but for reasons beyond this committee's time, the plans did not move forward this fall. We do have a general agreement to help, but most Minnesotans expect that if we're going to spend $300 million, we should address some of the underlying problems in this market. I've defined 4 problems: premium increases, unexpectedly narrowed networks, uncertainty in the individual market, and a lack of options in Greater Minnesota. We are proposing some recommendations to alleviate the pain of each of these problems. Nearly $300 million for premium relief, continuity of care funded in this bill, reinsurance, which will be part of the A6 amendment to alleviate some of the uncertainty in the market, and small employer reforms, including MEWAs, that will be addressed in the A6 amendment to address the lack of options in Greater Minnesota. And with that, Mr. Chair, I have the A6 amendment that I would like to have acknowledged as an author's amendment and moved by a member of the committee.
Thank you, Senator Benson. Senator Chamberlain.
I'll move the amendment, Mr. Chair.
Senator Chamberlain moves the A6 amendment, which is a delete all authors amendment. All those in favor signify by saying aye. Aye. Opposed, no. Motion carries. Senator Benson.
Thank you, Mr. Chair. There's also the A7 amendment, which takes care of some data provisions in parts of this bill. We can discuss them here, but for the committee's benefit, in order to move this quickly, we have copied language out of this bill that impacts the Judiciary Committee, and it was introduced as Senate File 55 that will be heard this afternoon. And we've copied the human services provisions in this bill. It was introduced as Senate File 56. Those will be heard this afternoon. And this amendment will be introduced this afternoon as well. And so, Senator Limmer, if you could assist me with the A7 amendment.
Mr. Chair, I move the author's amendment, the A7 amendment.
Senator Limmer moves the author's amendment A7. All those in favor signify by saying aye. Opposed, nay. Motion carries. To the bill, Senator Benson.
Thank you, Mr. Chair. The bill that is in front of us, let's begin with Article 1, premium assistance. This has raised a bit of concern with MMB because we are asking them to take on responsibilities, and I want to acknowledge that, and we are happy to work with them in order to make this a workable solution for the people of Minnesota. We've decided to means test this bill. By running it through MMB, it allows us to control accountability, it allows us to control data, and it allows us to protect program integrity. We transfer $300,500,000 from the reserves to the general fund. During the first 3 months of premium assistance, all enrollees in individual insurance who are not eligible for advanced premium tax credits would be eligible for a 25% premium rebate. And then members on the A6 amendment, if you refer to page 3, you will see that we have broken down between 300% of the federal poverty guideline and 800% of the federal poverty guideline. We have graduated premium rebates. We think means testing is a reasonable step to take, and that requires that MMB, the state, be involved because we have to do income verification and we need to protect individuals' data. Let's see, we're going to request residency verification and we're going to request an audit. It's also important to note that the data collected in this provision will remain private for the benefit of the citizens of Minnesota. And Mr. Chair, I'll be happy to stand for questions at the end of my presentation. If I could ask members to turn to page 6. You look at the insurance market reforms. And continuing to page 7, line 4. Those of us who've been working with insurance for a while know that final filings occur much earlier than rates are disclosed to the public. We think it would be beneficial that when all of the plans have submitted their rates for the year, that information be made public. It allows us to have the earliest possible visibility and transparency in the rate setting process. Moving down from there, line 11 and below, we changed the stop loss points. This helps small employers access reinsurance. We remove the limit on the number of employees so that an employer with, say, 20 people could consider an alternative to the small group market as it stands now and access policies that are more competitive with large employers in both structure and cost. Continuing on to page 8, at the bottom, line 27, we introduce the for-profit HMO. This has been talked about for a long time in the state of Minnesota. Let me clarify something. As we read this language and it says a foreign or domestic corporation, I'd ask members to refer to Chapter 302A. A foreign corporation is any corporation organized for profit in states other than the state of Minnesota. This doesn't mean we're bringing in a German company necessarily. It means that if they're incorporated in Delaware, if they're incorporated in South Dakota, they can do business here in the state of Minnesota as a for-profit entity. The for-profit cleanup language is quite extensive. We continue through page 10, page 11, page 12. At the bottom of page 12, there's a significant new option available for small employers brought to us by the 21st Century Cures Act. It's a defined contribution plan that would allow an employer to put a specific amount of money, tax preferred, not counted as income, into a fund that an individual could then use to buy insurance on the individual market. We think it gives the employer with 5 people who'd like to compete against a large employer that offers health insurance a little something to say to their employee or a potential employee. We're doing our best to give you health insurance. We'd like you to join our team. We think this will help our small businesses in a competitive hiring environment. Transition of care coverage. This has to do with the narrowed networks and access concerns that many people have expressed. This is for calendar year 2017 only. It applies to those enrollees who lost their plan due to an involuntary termination, a health plan that pulled out of the market or a health plan that pulled out of their particular geography. And members, we copied this language and used as guidance the existing continuation of care language that is in statute and has been well vetted. Looking at the specific language at the bottom of page 13, for 120 days, if you have an acute condition, a life-threatening mental or physical illness, pregnancy beyond the first trimester, a physical or mental disability, we've moved to page 14, a disabling chronic condition that is acute, and if you are at the end of life for 6 months, you can continue your care. This will require coordination between plans and providers. There are provisions for reimbursing the plans, and there is money appropriated in this section. The appropriation, members, is at the top of page 16, $15 million to accommodate continuity of care in this transition. On page 15, just going backwards just a moment, section 17, we have some questions for the Department of Commerce over how do we do residency verification for individual market participants. How do we use two particular portions of statute that were meant to provide flexibility in our market and don't seem to be utilized very well? And then reforms to various health laws, barriers to filing new plans in the state of Minnesota. And members, then we move to reinsurance. This is new language, wasn't introduced in Senate File 1. It has been talked about extensively on healthcare financing task forces, and in it was part of the conversation during special session. Reinsurance, people are familiar with. Many people have been talking about MSHA, MSHA 2.0, the Alaska model. This reinsurance proposal uses the MSHA board. And again, we are always open to ideas for how we improve governance. So please know that this is the beginning of the conversation. Let's see, the assessment to pay for this is similar to the MSHA assessment. So we already have a source of funds for this provision. And then as we go to page 18, here are some of the beginning details, and I look forward to Commerce's opinion on how this will impact rates. If you look at the middle of page 18, a claim exceeding $70,000 would qualify for reinsurance. The cap is set at $250,000. And throughout that band between $70,000 and $250,000, there's coinsurance. Members, one of the advantages we believe this gives is that the carrier, the health carrier, would have incentive to continue to manage the cost of care throughout the cycle of care instead of simply recovering incurred costs after the claim has been attached. And so there's definition of how the payments will be carried out. Moving forward from there, and I'm trying to be thoughtful, members, but I want to move quickly. There are provisions for accounting, reporting, and auditing so that we maintain transparency on this very significant amount of money. We will need a state innovation waiver because this has interactivity with the Affordable Care Act. Again, human services provisions will be covered in the Human Services Committee tonight. And this afternoon. Article 4 is the Agricultural Cooperative Health Plan. There's been a lot of talk about MEWAs. We're trying to find ways to help Greater Minnesota, particularly the ag community who is so dependent on individual insurance, have access to alternative products. And this is language that has been developed in conjunction with the co-ops. It gives those co-ops the opportunity to access an ERISA model instead of Minnesota Small Group or having their members be in the individual market. It requires that they have a joint insurance plan, that they work through the cooperatives. They engage in stop loss and individual coverage by a Minnesota insurance company. They establish a reserve fund. There is a participation requirement of 3 years. So once you're in, you have to stay in and let things stabilize. There is a single risk pool which helps spread the cost and risk of that market in a larger pool than the individual buying their own coverage. And members, that is a very high-level summary of this bill, and I would appreciate your comments and support.
Thank you, Senator Benson. We'll open it up for questions. Do members of the committee have any questions for Senator Benson? Senator Hayden.
Good. Well, thank you, Mr. Chair, and thank you, Senator Benson, for a very thorough and thoughtful bill. I know that you've worked awfully hard on it. We've been talking about this for quite some time. Mr. Chair, I have several questions, but I have an initial question and then a request. So my first question, Senator Benson, how much does this bill cost?
Senator Benson.
$300 million.
So, Mr. Chair, Senator Benson, including the reinsurance provision?
The reinsurance provision, I've requested a fiscal note, and I haven't been given a fiscal note for the reinsurance provision.
Mr. Chair and Senator Benson, have you had any ballpark idea of what reinsurance might cost?
Not for this model. I've requested it. I've actually been requesting that Commerce give us some information on reinsurance for well over a year, and I have finally gotten language drafted, and so we're hoping that Commerce will deliver a fiscal note.
Well, good. Well, thank you, Mr. Chair. Mr. Chair, I think it would be, I think there are several questions. This is a lot. For instance, there's been models that says reinsurance costs $500 million. I don't know if that's what this model is, but I mean, that's a lot of money. There's a lot of provisions. There's a lot of change in policy. But I think it might be apropos, Mr. Chair, and it's, obviously at your discretion if MMB could kind of help us, give us an overview of the bill from their perspective. I think that might answer a lot of questions that I have. Otherwise, I have probably 15 questions.
MMB will have the opportunity to testify when we get to testifiers, so.
Okay, well, Mr. Chair, maybe I'll wait for them, but otherwise I hope we have enough time at the end if those questions aren't answered, because there's a ton of questions. This is a lot of language, on provisions that I'm not sure are directly connected to the premium relief that we have. There's probably a lot that we could go through, so hopefully after Commerce and MMB come, we'll have some time to ask questions.
And
Thank you, Senator Benson.
Mr. Chair, if I could, to Senator Hayden's point on the $500 million, I've heard that number thrown around a lot. I have never seen an actual analysis, and so if Commerce has the analysis on the $500 million that continues to be referenced, I would appreciate seeing how they developed that calculation. It might give us some sense of what other costs might be incurred in this bill.
Thank you, Senator Benson. Other questions from the committee? Senator Latz.
Thank you, Mr. Chairman. We just got the delete everything amendment now. Senator Benson, could you explain what the differences are between Senate File 1 and the delete everything amendment? And can you indicate when the delete all was provided to Senate Counsel and to partisan staff to help us prepare for today's hearing?
And
Senator Benson.
Mr. Chair and Senator Latz, I can't speak to when the language was provided to partisan counsel. I received it about 8 o'clock this morning, and we had planned on doing an author's amendment to sort of clean up the edges to senatify the House language, as it were. But we wanted reinsurance added to the bill, and we wanted the agricultural cooperative, and we thought it more efficient for committee time if those were incorporated into that language. The significant provisions, there were some changes in definition. We did add a private data provision to the information that the plans would send to MMB. And so that was added after Senate File 1 was introduced. The entire reinsurance article is new language, and the entire cooperative language or cooperative network provision is new language. We did delete, and it is my fault that I overlooked this in my bill summary. We took out the surprise billing language. There was surprise billing language in Senate File 1. It is an issue worthy of its own vetting. It is an issue worthy of going through the committee process on its own, perhaps as part of other reforms. And so we thought it best to take it out and let it travel on its own.
So, Mr. Chairman?
Thank you, Senator Benson. Senator Latz.
So the reinsurance language was not part of Senate File 1, and most of us are seeing that for the first time when we sat down at our desks here at the committee, if I understand correctly. And same with that cooperative network language. So that's an awful lot to ask us to digest here. At a brief glance, as Senator Benson indicated, a high high-level overview
Yes.
of your bill, which sounds like is about all we're going to get in the hour we have left of this committee hearing. Which portion of your bill relates to premium relief?
Senator Benson.
Mr. Chair, Article 1 relates to premium assistance.
Okay, and so, Mr. Chairman,
Senator Latz.
so everything else that's in the bill that you went over, Senator Benson, is not they're not things that are so critically urgent for people who seek to access the health care market before the end of January. So what's the rush on the rest of the bill?
Senator Benson.
Mr. Chair and Senator Latz, as you're aware, being a member of the Commerce Committee, rate filing starts in earnest in May, and the actuaries at the insurance companies and the people who develop products at insurance companies need to have a transparent view of the market. It's my understanding having that information to them by March is critical to being able to impact the 2018 market. And so as we're working on relief for 2017, we also need to be working on the underlying problem for the 2018 market, or we're going to end up in the same place next year with very high premiums and having taken no action to solve the underlying problem. And so it's not panic, it's an awareness that there is an external timeline. If this committee cares to impact the 2018 market, we have a limited time frame to do that. And I have been asking for reinsurance language for a year from Commerce, and this is the first opportunity I've had to push that issue. And so I would have gotten it to you as soon as I possibly could. It was something that I raised with the governor during special session negotiations. We brought up MEWAS, which is the cooperative language, during special session conversations. There was no attempt to hide this provision, but there is some timeliness that is important with that as well as the premium relief.
Mr. Chairman?
Thank you, Senator Benson. Senator Latz.
My understanding from what Majority Leader Gazelka said on the floor was that we expect to have the full health insurance bill for consideration by the full Senate on Thursday. And so I understand maybe a get this done by March decision, so rate filings and actuaries can get their work in by May, but why does it have to be done in the next 2 days? Especially with new language, and no matter how long it took the Department of Commerce to provide language, I know there are others around the Capitol that can draft language for a reinsurance program. Don't have to rely on the Department of Commerce if they're not forthcoming to Senator Benson's request.
Senator Benson.
And Senator James, Mr. Chair, and Senator Latz, it's not the language that's the problem, it's the analysis of how it impacts rates that has been the challenge from Commerce.
Well,
And so we're hoping that now they will take action and tell us how a reinsurance pool could impact rates.
Mr. Chairman, it seems to me we should have that information before we vote on whether or not reinsurance is a good idea. And I don't see that we're going to get that analysis unless we get a surprise today. I'd be surprised if we had that analysis in the next 45 minutes for us to be able to make an informed judgment about whether a reinsurance program is a good idea for the people of Minnesota.
Thank you for bringing up your concerns, Senator Latz. Do you have any other questions?
Yeah, I was a little, there's a lot of changes to the health insurance system that are being proposed here. I'm a little bit confused because Senator Benson mentioned from the for-profit. I mean, that's a for-profit HMOs. That's a huge change from decades and decades of practice in Minnesota. And it would lead to, as Senator Benson described, foreign corporations entering this market, which our regulators don't have any authority to regulate. They're regulated in their home states, is my understanding. She described it as cleanup language and extensive, so I'm not quite sure which it is. Is the 5 pages or so that's in here, is it cleanup language or is it extensive, and how are we going to be able to vet that in the next 45 minutes?
Senator Benson.
Mr. Chair, when I refer to cleanup language, any reference to nonprofit or its related terms had to be taken out. And so that's cleanup language. The provision is an extensive change. And for those people in greater Minnesota who have one option, we're trying to give them another option. We're trying to see if anyone wants to come in and serve those citizens and provide them individual health coverage. And so when you use the word foreign, I know it's going to end up on a lit piece somewhere, and that's fine. I think you understand what foreign means, and they could only offer products that met Minnesota's requirements. That's what Commerce does. They have to offer products that meet Minnesota requirements.
Mr. Chairman?
Senator Lance.
I'm very clear on what foreign means. It means a non-Minnesota corporation, which means that the New York or California or Arkansas or Missouri insurance regulators will be regulating those companies that come to provide products for purchase by Minnesotans, which may or may not be actuarially sound enough to meet Minnesota's standards. But I also understand, and I'm not necessarily critical of this, there may be many good ideas in the proposed changes here. I just don't see how we can make an informed decision on these extensive insurance market changes in a very short one-day hearing today. I'd be hard-pressed. I bet you if we asked in 45 minutes, if we asked every member of the Commerce Committee to explain what was just proposed, we wouldn't be able to get a detailed explanation from most of the members of the Commerce Committee, let alone a clear understanding of the implications. We certainly won't have time to hear testimony from all of the interested stakeholders in major changes like this.
Thank you, Senator Lance. Senator Pratt, you have a follow-up?
Yes, thank you, Mr. Chair. So, Senator Benson, you mentioned that Commerce would have to review the plans coming from foreign corporations. Can you confirm that Commerce does in fact have some oversight and is evaluating the plans that are coming in?
Senator Benson.
Mr. Chair and Senator Pratt, Commerce has purview over insurance in the state of Minnesota except for ERISA plans and any other entity that is federally regulated. So if they offer a product, they have to meet, Commerce has say.
Thank you, Senator Benson.
Thank you.
Senator Hayden.
Well, thank you, Mr. Chair, and just to follow down the line of Senator Latz, Mr. Chair, this is my first time on the Commerce Committee, though I have served with Senator Benson and others on the Healthcare Committee, so I have some familiarity with what kind of Senator Benson is putting together. But the Commerce Committee really does, I think, has to take a really good look at this issue of for-profit, just one of many things in this bill. And I agree with Senator Latz that today's probably not the day. This is, I don't know, 6th, 7th day of session, and I know that we're under some time crunch, but this bill was given us under the premise that we were trying to immediately give premium relief to the Minnesotans that are having to make some decisions, that have had to make them all the way back from October and will have to make a final decision if they haven't January the 31st. So though bringing in for-profit insurers may or may not give more access to consumers, it may or may not help the marketplace, but that's something that I think we need a lot of time to, or at least an appropriate amount of time with the public and stakeholders to try to vet that. So I don't see why we would need to do that today in correlation with what the guys on the premise of why we're here today and why we're not doing an overview. I haven't had an overview to your committee yet, and why. But we're pushing this. So I would really suggest to Senator Benson that we slow down this process, and that there'll be time for many provisions, but this one in particular, to stand alone as a bill and get the proper vetting. And if that's what the committee's and the legislature's pleasure is, I think that that's what we should do. But, Mr. Chair, let me just get to a question.
Mr. Chair, to
Senator Benson.
To Senator Hayden's point, Chapter 62D.02 will be reviewed today in HHS, Department of Health. Does also co-regulate HMOs, and it's a committee you're familiar with, and so you'll get to see this language again later this afternoon, just just to
Thank you, Senator
give you
Benson.
some
Senator
comfort.
Hayden, would you
Well,
get your
Senator
question,
Benson, I
please?
appreciate that and seeing it there and seeing another day, but I do think that this committee has a certain amount of jurisdiction that, and I don't know anybody on this committee, I'm looking around, that's on the Department of Health, so maybe I get the vantage point of seeing it again and come up with some questions between now and then.
have a question,
to try to
Senator
figure it out. Well, I just wanted to answer her question. I just wanted to answer her statement, Senator Dames. But I do have a question. Senator Benson, on the reinsurance portion of the bill, do you know what the effect that would have on the federal reimbursement for BHP?
Senator Benson.
Mr. Chair, I'm told that there's a fiscal note being prepared, but to fully ascertain the effect on the BHP, Commerce would have to show us the effect that reinsurance would have on rates in the market.
Thank you, Senator Benson.
So, Mr. Chair, just to a follow-up with that, and I know that there's others that probably have questions,
Well,
but
we're
I'd
gonna
love to
move
see
on to
M&B.
testifiers. You're
Well,
short,
but let
so
me
if
just
you
say
want.
that I think that there's a pattern that we're starting to see, that we don't have the proper information in order to evaluate if this bill is good for Minnesotans or not. There are not fiscal notes attached to it. There are a lot of moving parts. I think we need to say that loud and clear, and I appreciate the work that Senator Benson is doing, but we're not quite ready because we don't know the underlying numbers to the bill that she's put before us.
Thank you for expressing your concerns. I do appreciate it. I think at this time we'll call the testifiers forward. I know we have some people that have traveled for a distance, and I'm
Senator
sure
Daines.
they're going to want to try to get out of here yet today. So we'll start out. The first testifier, Bentley Graves, would you come forward, please? Senator Champion.
Thank you, Mr. Chair. I had a question for Senator Benson, if that's okay, Mr.
Yep,
Chair.
go ahead.
Under Section 11 on the A6 amendment, which talks about transition of care, I also looked at the request for authorization. So can Senator Benson, and I know that there's other information that is being sought, but can you explain to me what happens, let's say a person requests to remain with a provider that is now considered outside of the network? I see that under subdivision 5 that the health plan company could require medical records and other information in order to determine if that request should be granted. And I see that there's language that talks about if it's denied, that the company would have to explain. Can you tell me if the patient has another opportunity to appeal the decision of the health plan company that says they cannot remain or retain their coverage or receive services from their existing doctor that they want to stay with?
Senator Benson?
So you mean after the initial appeal? So generally, Mr. Chair, my apologies, and Senator Champion, appeals generally go to a second level, usually an external appeal. If you go through utilization review, your appeal goes to an external board, and those provisions are in place at plans now when there has been a denial of service for something that the plan deems unnecessary.
Chair
Thank
Dane?
you, Senator Benson. Senator Champion?
So if that is in place now, then why do we have this new language here? Because so it's two parts. Why do we have the new language? And number two, who makes the decision as it pertains to what the rate is going to be? So if a person is currently being seen by a doctor,
Yes.
their new insurance does not have a contract with their prior doctor, the patient wants to remain with their current doctor if they meet the criteria articulated in this article.
Yep.
But usually there's a difference in the pay rate, because when you go to someone who's in your network versus someone who's outside of your network, there's a difference in the rate and the cost. The question is, then who pays that cost? I know that you said something about a $15 million pool. So then the question is, who makes the decision whether the person can continue with that doctor, and is there a threshold dollar amount as to what a person cannot go over in order to get any relief from that $15 million fund?
Senator Benson.
And Mr. Chair, perhaps Senator Champion, subdivision 4, so they accept payment as the lesser of the health plan company's reimbursement for same or similar service, the provider's regular fee for service. They request authorization for services in a form and manner specified by the new enrollee's company. So it's the new enrollee's company that would manage this process and request the reimbursement. And when the $18 million is gone, it's gone. And I'm actually looking for some more solid information to see if we need 18 million or if we can lower that number.
Chair Dames, if I can ask a question just about line
Senator Champion.
14.26 to 14.27. If what you say is true, then there would be no need for the $15 million fund. Because according to this language, it says, except as payment in full the lesser of the plan's company's reimbursement rate for in-network providers for the same or similar service. So if there's a requirement that they must do it for the same or similar service dollar amount, then there would be no need to say that there's a difference between the payment and therefore the fund of $15 million wouldn't be necessary.
But Mr.
Thank you,
Mr. Chair.
Senator Benson.
Champion, what if they don't have an in-network provider that provides that same or similar service? What if it's a specialty coverage in an acute case? And so it would be the provider's regular fee schedule. So we sort of go from the most conservative reimbursement to, okay, let's figure out how, if you're a plan with this new complex case, how are we going to sort of minimize the amount of reimbursement you're going to get? And those are the steps that you see here in subdivision 4.
Thank you, Senator Benson.
So I do have one last question.
Go ahead. Thank you. Senator Champion.
So Senator Benson, on the same line of questioning, what happens if the person goes to the out-of-network provider who was their previous provider, and the health company denies them the option to continue to receive the service in that same similar way? Who then pays for the service that the person has been providing?
Senator Benson.
Mr. Chair, if the person cannot access the provisions in this bill for out-of-network, then the individual would have to pay for that. It is not the best option, and we hope that this will be broadly interpreted so that those people who are in the most acute or chronic phase of their disease will have 120 days of coverage and can transition to a new provider and can be assisted in that transition. Assistance in transition is one of the requirements of the appeals process and the request for authorization process. If it's denied on appeal, even with an external review, it goes to the individual, Senator Champion.
I'm sorry, I couldn't hear you.
It goes to the individual.
Thank you, Senator Benson. As long as you said that was your last question, go ahead, Mr. Graves, and would you introduce yourself and state who you're representing for the record?
Sure. Thank you, Mr. Chairman. My name is Bentley Graves. I'm the Director of Healthcare and Transportation Policy at the Minnesota Chamber of Commerce. And just for kind of level setting, the Minnesota Chamber has 23 members around the state, all types of business, all sizes of businesses in every corner of the state. And I appreciate the opportunity to provide some testimony here today. You know, typically the individual market is not something that most people think the business community has much interest in. Usually they think of the group market. But it is important to us that we find some stability and some support in the individual market for two reasons. One of which, this is where self-employed individuals go, and we certainly have a number of members who are self-employed. That's where they go for care.
Mr. Chair.
Senator Hayden.
Good. Excuse me, Mr. Graves. Mr. Chair, the purpose of this bill and the primary purpose is to figure out how to get premium relief to Minnesotans in the individual market. And primarily in Senator Benson's bill, beyond all of the other issues, is there is a a real responsibility that she places on the department, our MMB. And so I appreciate Mr. Graves and what he probably is going to say, because he's very skilled. But I'm wondering, Mr. Chair, if we can't, for context sakes, at least get the department who is responsible for this, starting with MMB and then the Department of Commerce, to help us frame out what this looks like, as opposed to advocates one way or the other to this bill. I was just wondering, that would help me a lot.
And we will have the department testify. They're on the list. They'll be up here, so we'll be getting to that.
Mr. Chair, I'm concerned we're running out of time, and this is a real urgency for Minnesotans.
And so we'll keep moving along, then we'll conserve some of our time. Thank you.
Mr. Chair, if I might,
Senator Champion.
Without being disrespectful, I'm inclined to agree with Senator Hayden simply because I'm not a healthcare person, and I'm not one who fully always understands the complexity of everything that we see here. And it's good for contextualization to have those individuals who are responsible for the interworkings of this bill to kind of help put it all in context, so that we at least get their information one right in back of the other, as opposed to advocates. So I am asking you as the chair, we are not going to deny Mr. Graves the opportunity to testify, but perhaps the order in which these things happen can be helpful for the committee. So it would be helpful for me to have MMB and Commerce to really testify, so that we can kind of understand the inner workings of, like, the reinsurance questions or the foreign or for-profit entities, and whether they have the ability to monitor those folks and oversee or regulate those folks, and some of the interworkings. So with that being said, Mr. Chair, I hope that you will take our considerations to heart.
Thank you, Senator Champion. Like I say, we will be hearing from the departments, and so I know we've had some people here that have traveled in for a way, and I want to make sure that they get an opportunity to testify. So we'll continue to move on. Mr. Graves.
Thank you, Mr. Chair. As I mentioned, the individual market is something that the business committee has an interest in, both for those who are self-employed, and also a growing number of small employers who have moved to kind of defined contribution arrangements, helping their employees shop in the individual market. So we appreciate the quick action by this committee, by the Senate, to undertake this legislation to get support into the hands of the folks in the individual market quickly. And you know, also, I just want to make the point that you know, this bill does have a couple of provisions in it to help small employers in the small group market. And while it's not necessarily at the same crisis level, we have seen a lot of issues in the small group market in the last couple of years. The small group market has shrunk by a third over the last 2 years alone. We appreciate the legislation opening up the opportunity in a greater way to small businesses who would like to choose to self-insure, putting them on an more even playing field with large employers. We certainly appreciate the language in here, making it easier for Minnesota businesses to take advantage of the changes recently made at the federal level to allow these small employers who have kind of gone down the route of defined contribution to do that in a pre-tax way. And then also the legislation provisions asking the Department of Commerce to look at different new insurance market options, again, that would benefit the group market. So recognizing that there is significant issue in the individual market, and the reforms and the stability programs and support programs in place through this legislation for that, but also appreciate the important steps that are taken to help small employers. The only last thing I would say, Mr. Chairman, is we're just catching up today with the specifics of the reinsurance program. We agree that something like that is likely needed to stabilize the market going forward. We do have some concerns about how this particular proposal would be paid for through an assessment on just the fully insured market. That's something that we've had a lot of concerns with over the last number of years, and have been working through in discussions about how to take that forward as this legislation progresses. So we want to continue that conversation, but certainly want to flag that as a concern of ours. With that, I'm happy to answer any questions.
Senator Hayden.
Good. Well, thank you, Mr. Chair. So, Mr. Graves, what do you think about the premium relief portion of the bill, Article 1? Or what's the chamber's position? Maybe I should say that.
Mr. Graves.
Mr. Chair and Senator Hayden, as I mentioned, the business community, by virtue of the fact that there are self-employed folks in the individual market, and a number of small employers have helped their folks move to the individual market. We want to see some relief for those folks, and this certainly puts together a package to do that.
And then one follow-up, Mr. Chair.
Senator Hayden.
Mr. Graves, does the chamber have a preference of where those dollars come from? Senator Benson's bill has it coming out of the budget reserves. It could come out of the surplus. It could come out of the Healthcare Access Fund. Does the chamber have a position on where they think this money should come from if we move forward?
Mr. Graves.
Mr. Chairman, Senator, I think the idea of using it from the general fund by way of kind of tapping the surplus and the dollars that are there for emergency circumstances like this is certainly one way to do it, and certainly makes some sense. I think I heard some legislator in the last couple weeks say, there are because of our financial situation here in Minnesota over the last few years, there are resources available for rainy days, and it's certainly raining for a lot of folks in the individual market.
So, Mr. Chair, Mr. Graves, you said all three sources.
Senator Hayden.
Which one does the chamber want? Do you think it should come from the general fund, or do you think it should come from the reserves, or do you think it might come from a fund like the Healthcare Access Fund? What's the chamber's position?
Mr. Graves.
Mr. Chair and Senator, I think that's still, it seems to be an open question for the legislature to be debating. I think we've made it clear, though, that when it comes to the financing mechanisms, it should be broad-based. Again, when it comes to the reinsurance program in particular, that is a funding source that we do have some concerns with. The way that the premium assistance program is funded in the current bill, I think makes some sense, but obviously there's some work to do in nailing that down and building consensus. So, we're open to that conversation going forward.
Thank you, Mr.
Thank you, Mr. Graves. I think we'll move forward.
Mr. Chairman.
Let's just make it a short question because we're running out of time with the time allotment we put in for each testifier. Senator Latz.
Thank you, Mr. Chairman. Mr. Graves did mention that he thought some of these changes would improve the circumstances for small businesses, but the information that I have with regard to stop-loss coverage as an option to be made available is that it would likely raise rates on small businesses, and making it easier for small businesses to self-insure would create an adverse selection problem, increasing premium rates on the overall pool. Mr. Graves, do you have a position on that, or does the chamber?
Mr. Graves.
Mr. Chair, Senator, this is actually a question that Congress wrestled with a bit during the passage of the ACA. They commissioned a study that was done by by RAND to look at this very question, and the conclusion there was that adverse selection and a negative impact on the full insured market wasn't a significant concern.
Thank you, Mr. Graves. Would Mr. Hickey come forward, please? Please go ahead and state your name and who you're representing for the record.
Well, hello, Mr. Chairman, and it's great to be calling you Mr. Chairman, but Mike Hickey with the National Federation of Independent Business. We represent 11,000 small businesses across the state, and we are clearly the most affected group by this law. A lot of our members are in the individual market, and with 11,000 total, there's a lot of people out there who have been very adversely affected by the federal health care law. We want to thank Senator Benson for bringing this bill forward and really trying to address this in a comprehensive way. We really are cleaning up the mess of the federal health care law. People have been devastated with huge increases, all the things you've heard about and Senator Benson talked about, severe narrowing of networks, loss of continuity of care when you're gravely ill, maybe deathly ill, and all sorts of nightmares have occurred in the last couple of years. And so this legislation is needed and appreciate her effort. We also strongly support the stop-loss provision. Small employers need more options. And I have heard the concerns about adverse selection. I guess I would just caution people that it takes a lot to do this. I don't think you're going to see an exodus of people trying to go to that, especially with the likely dramatic changes that are going to occur to the federal health care law. but it is an option for small employers. It's been a very unlevel, unfair playing field for a long time, so especially lowering the attachment point to $10,000 makes it much more doable for small employers and something we've supported for a long time. We also appreciate the provision in Section 10, Article 2, that conforms to the new federal law that just passed and will help small employers assist their employees with their premiums in the individual market on a pre-tax basis. As you know, another important provision was removed from that law, from the federal law, through the recent bill that just passed the Congress that removed a ridiculous penalty that was on small employers who were just trying to help out their employees with contributions to their individual market plans. And that was an important change. It's important for us to conform to this. I have just seen the reinsurance language for the first time, but it appears to me, actually, I'd just like to pose a question to Council first, Mr. Chairman, to make sure I am understanding it correctly. It certainly appears to me that we're bringing back the MCHA assessment. Is that how the language should be read in sub 8 of the reinsurance piece?
Mr. Sting?
Mr. Chairman, members, that's essentially correct.
Thank you.
Thank you. That was my reading of it and others, and we're just extremely concerned about that and will be strongly opposed to that. That was one of the most unfair funding sources we ever had. Historically, they used to assess the plans and then gave them a credit, and a really bad change was made in the conference committee by somebody who didn't really know what they were doing years ago, and we were stuck with it for years, Mr. Chairman. After that occurred in the 80s, the flight to ERISA occurred, and this assessment got more and more and more unequitable and fell on a smaller and narrower base. And the reinsurance piece, Senator Benson, probably is the most important part of this bill, but we really need to find a more equitable funding source to make this work. Obviously, we need the reinsurance piece to try to lower the claim costs for the insurers and thereby lower the premiums, but we're very concerned about that, and hopefully we can keep the discussion going, because we're going to be strongly opposed to bringing back the MCHA assessment.
Thank you, Mr. Hickey. Any questions for Mr. Hickey?
Mr. Chairman?
Senator Lance.
Thank you, Mr. Chairman. Mr. Hickey, would your members prefer to have an immediate 25% reduction in the premiums that they pay in the individual market, or would they prefer to prepay 100% of the premiums and in 9 to 12 months or longer receive a refund from the state?
That's a hard one to answer, Senator Lance. We got people in both categories. So, we got people who provide the traditional group plan, and we got people who are in the individual market, and then people started trying to help their employees out. So I can't really answer that.
Well, Mr.
Thank you,
Chairman,
Mr. Hickey. Senator Lance.
Mr. Hickey, you stated at the outset that many of your members are in the individual market, and that's a critical component here. So I'm finding it hard to understand how they might prefer to have to prepay 100% of the premiums and wait 9 to 12 months to get their 25% reduction in the form of a rebate rather than not have to pay as much in the first place.
Any comments, Mr. Hickey?
Senator Lance, I can just tell you they're probably split about evenly. I don't have very recent data on it, but the group people are dedicated to that. The individual market people are mostly in the individual market because they can't afford health insurance, and the change here is going to make it easier to help the employees.
All right.
Senator Champion.
Thank you, Mr. Chair. To Mr. Hickey. Mr. Hickey, I'm sure that you've had an opportunity to read this bill and the proposals that have been put forward. Can you tell me if the proposal to build a new sort of bureaucracy with the department, that folks have to provide information, that information would be tested by a number of different people, which would mean more red tape? So are you in agreement with that new bureaucracy and that red tape, or are you one who would move towards a lack of red tape and for there to be opportunities or relief for your members, no matter if they're in which category?
Mr. Hickey.
We really don't have an opinion on that, Senator Champion. I know the governor does not want to go the route that this bill goes. I think it's important at the end that we provide relief we'll leave those details up to the legislature and the governor. But I think it's important that, the significant relief that the bill provides, and we appreciate that.
Thank you, Senator Hayden.
Well, Mr. Chair, I'm going to kind of beat this dead horse. Senator Champion invoked that there was going to be some sort of new bureaucracy and red tape and other things that would happen. I'm not really sure what that means or what that looks like, and I'm looking at the Commissioner of Management and Budget and the Commissioner of Commerce in the back of the room. And Mr. Chair, I'm going to renew my request to get them to the table to help us put in the context, because I think that we're putting Mr. Hickey and others, and even Senator Benson, at kind of a tough situation to answer questions, and we don't have the context as to what this might actually look like in a very pragmatic way. How does this play out? So, Mr. Chair, we're running out of time. I think it's really important to get the actual folks who are going to have to regulate this, are going to have to implement this, to the table in order for us to be able to answer these questions appropriately.
And Mr. Chair, and if I might, and to Senator Hayden's
Senator
point.
Champion, you've not been recognized.
Oh, I'm sorry.
Let me respond. Senator Hayden, I appreciate you bringing this up. If I'm going to have the testifiers testify, and then if we need to go to recess and come back later on tonight, we will probably do that. So let's let the testifiers that drove a ways to come, let them do their testifying, and then, depending on what time it is today, if we recess and come in back tonight, then we can have MMB and we can have Mr. Rothman testify then. Okay? Thank you. Senator Champion.
Thank you, Mr. Chair. Sorry for the interruption. I thought I was recognized. Mr. Chair, I'm looking at the testimony for today and the order that has been supplied to the committee. So do we have a sense of where the commissioners would testify? Would that be after all the other testifiers who are articulated on the sheet have an opportunity to speak, or where are they going to testify? Because I don't see their names on the list of
They will be testifying after number 6, and we will call them up then. And I'll reiterate, if we run out of time, we will recess and we'll come back this evening. Okay? Thank you. Thank you, Mr. Hickey.
Appreciate the time.
Appreciate it. Mr. Schneeman and Mr. Spazzetto, would you please come forward? Thank you, gentlemen. Would you please state your names and who you represent for the record and present your testimony?
Mr. Chairman, Dominic Spazzetto, and if it's okay with the chair, I'll go first and then turn over to Mr. Schneeman.
Just fine. Thank you.
Thank you. I'm here today representing an organization called the Agents Coalition for Healthcare Reform, which is basically a group of the 4 professional insurance agents associations in the state. The Independent Insurance Agents Association and the National Association of Insurance and Financial Advisors, both of which I have the pleasure to represent at the Capitol. The Minnesota Association of Health Underwriters, which Mr. Schneeman represents, and the Professional Insurance Agents Association. We represent about 6,000 insurance professionals throughout the state, and we have been in the front lines of what we consider to be the collapse of our individual health insurance market in the state. I don't need to tell you the stories that you've heard of people paying insurance premiums of $30,000 a year with $5,000 or $6,000 deductible. Those people are making decisions to go without insurance, and that's a very big concern for us. I basically came here today to support the premium assistance program that is part of this legislation. We think that as we look at healthcare reform in the future, this individual market premium melees is a giant pothole, I think, on the road to healthcare reform in our state, and it's something that we have to address as soon as possible. We would like to see it done in a quick and easy manner, and one that can be done fairly easy so we can explain it to our constituents who will be the recipients of this premium assistance. We also are interested in supporting, we haven't taken a formal position yet, on the continuity of care and the termination of coverage, which would allow people to have an opportunity to continue with the healthcare provider that they're currently seeing, even though that provider may be out of network in their new plan. We think it's worthy of discussion, and we're very pleased to see it in the legislation. I did not really come prepared to address the reinsurance proposal, but in all candor, we think reinsurance and the concept behind it is really fundamental to probably long-term insurance reform in the individual market. We kind of look at it as MSHA Part 2, and it really isn't MSHA, but we're using the MSHA system to set it up. It's basically a way of keeping guaranteed issue, which is basically current law, and something we think we should continue, where people get insurance. And then after the fact, the insurance carriers in the state will get together and try and figure out how to cover some of the losses in this experience. And what it really does is it doesn't single out any individual by saying you're uninsurable or we're going to deny coverage or whatever. It's all done in the back room after the fact. And I think that is a really great way to proceed. So regardless of how it's funded and the attachments points or whatever, we think it's a good idea to pursue, and we would probably support it going forward. Thank you, Mr.
Thank you,
Chairman.
Mr. Zzetto. Mr. Schneeman?
Thank you, Chairman Dom and committee senators. I'm, as Dominic said, the chair of the Legislative Committee of the Minnesota Association of Health Underwriters, and I've also own an independent insurance agency in downtown St. Paul called Seven Hills Benefit Partners. And I'm, to an extent, going to be affirming some of the points that Dominic made, but Minnesota insurance agents support individual health insurance premium relief. Not just this 2017 relief we're talking about, but we really support long-term reforms that will create premium relief in years to come. The cost for coverage has exploded since we lost the use of our MCHA program, and it's more broad-based pooling of large claims. So while the intention was to expand access to quality coverage, we have instead created new barriers to personal health insurance. Professional insurance agents have also been adversely affected with this change. To a degree, many insurance agents feel like a librarian in a library that has no books. The number of carriers offering coverage has shrunk dramatically. Policies that offer broad-based access to care are gone, and some carriers are choosing to limit their risk by canceling their agent appointments and eliminating commissions. Minnesota's consumers have high regard for their personal agent and need advice, especially during these difficult times. There are fewer and fewer agents able or willing to provide the type of personalized assistance needed. So it's very unfortunate that the situation has gotten so bad, but we think quick action to implement meaningful reforms can turn the tide, and this bill starts us on that path. We believe that even though the individual market serves only a small percentage of Minnesotans at any given point in time, a robust and competitive individual health insurance market is good for all Minnesota. Most of us undergo career changes, and access to high quality and affordable individual coverage is critical when other paths are not available. Premium assistance will be welcome to those who were shocked by the 2017 premiums, but in addition, agents are looking for a long-term solution which will be anchored by a reliable reinsurance mechanism. A few basic features that we have in mind for a reinsurance arrangement that we believe are tended to a degree in the new amendment here is, number one, applicants will never be declined, meaning that they'll be guaranteed to issue the coverage from the carrier of their choice and in the plan of their choice. Number two, that the risk seeding for high claims will occur behind the scenes. We call that retrospective. So there'll be no or limited health questions at the time that a person completes an application. Third, broad-based funding of reinsurance pool losses. That could be general revenue, could be the Healthcare Access Fund. We've talked about the MSHA model that appears to be what we're using in this iteration here, but broad-based is going to be critical for this to be successful. The fourth bullet is targeting net individual premiums so that once the reinsurance has been factored in, that those rates will not displace an employer's incentive to offer group insurance. Those are our points. Thank you very much for allowing me the time.
Thank you very much, gentlemen. Any questions for these two testifiers? Senator Hayden.
I always mess up your name.
Call me Chris.
Chris, well, I want to be formal. So I just have one particular question because it didn't quite get answered by Senator Benson because of the analysis. Are you concerned in the reinsurance pool of the loss of federal money based on how we know reinsurance works in other states? Because you named other funding sources that you thought would be broad. Would there be a concern from your perspective? And I know we've served on the Healthcare Financing Task Force, so I know you know what you're talking about. Are you concerned that we'd lose that federal share money?
Mr. Schneeman.
Thank you, Chairman. Senator Hayden, I'll know it when I see it. Let's put it that way. We're open to whatever might work. And if there's going to be federal resources, then it seems appropriate to tap them. I'm not sure what those are at this point, other than perhaps some rhetoric in Washington right now.
So, Mr. Chair, Mr. Schneeman, we receive reimbursements today for that population. So that's not rhetoric around. Rhetoric is what they're going to do moving forward. And so that, you're right, that's rhetoric. I know what we do today is we have reimbursements that come from the federal government that could potentially, in this current climate, that we could lose. Are you concerned about losing that revenue source?
Well,
Mr. Schneeman.
Thank you, Senator Hayden. If you're referring to the transitional reinsurance program, then that's not what you're referring to. Well, then I'll have to, because the transitional program fades out.
Well, Mr. Schneeman, maybe you're not the most prepared to answer that question, but so, Mr. Chair, I'll just kind of withdraw that, but I think that this, once again, kind of gets to a lot of work that we need to do on the bill.
Thank you. Senator Latz.
Mr. Chairman, thank you. Either Mr. Schneeman or Mr. Sposeto, would your agents' insureds, their customers, the people they care for, prefer to have premium assistance now or in about a year?
Senator Latz.
Gentlemen, whichever.
Chairman, the answer is yes.
Really?
Yes, they would like premium assistance now, and they would like the renewal to be a reasonable premium in future years.
Okay. Well, but if their
Thank you.
option is, I'm sorry, Mr.
Senator Latz.
Chairman, if the option is pay in full now and get relief in a year, or pay a reduced premium now, which would they prefer?
Senator Latz, I think he answered your question.
Okay. Preferred it now, as I understand it. Thank you.
Any other questions for the testifiers? Thank you, gentlemen. Would Mr. Sobocinski and Mr. Connie come up next? Gentlemen, please state your name and who you represent for the record, and whoever would like to go first, Mr. Sobocinski or Mr. Connie, go ahead.
My name is Paul Sobocinski. Senator Ames, thank you for the opportunity to testify. It's great to be here today in front of you and to be from your district. I work on behalf of the Land Stewardship Project. Our organization has about a third members who are farmers, a third are rural, and about a third otherwise. And we have about 4,000 members. And Land Stewardship Project has been involved in this issue of health care for the last 7 years because it's such a big factor affecting farmers and rural communities, and particularly people in the individual market. And we particularly see it really tough for beginning farmers, and we see it really tough for existing farmers in that 55 to 65-year-old age group. We feel that the situation right now is a crisis that needs to be addressed immediately with premium relief that's got out there. I kind of like to tell the story this way. On my farm, on my livestock farm, I have a farrowing operation. Right now, I have someone who's doing my chores at home, and I have sows farrowing pigs. If they're not taken care of right now, I lose those pigs, I lose the income. And that's kind of what we're facing with farmers and rural people out there. We need to get that relief out there right now so people know where they are. Our organization reached out to a number of farmers across the state besides just our members. And I can tell you from the multitude of stories, this is a real crisis that needs to be addressed and needs to be taken care of right now. So I appreciate the fact that this bill here does talk about immediate relief. How you do that, you need to find a way to do that with the governor and with this legislature. People need to come together and get this done. And I appreciate the effort and this bill being put forward. I also want to raise a couple concerns in terms about reform. I think relief first, and I think we need to carefully examine the issue of reform, about what could be done. I think the idea of looking at reform is important, but I want to urge some caution. And for example, one particular area that I would urge some caution on is the idea of knocking out the issue of bringing in for-profit insurance companies versus nonprofit. I think before you do that, you better very carefully examine that issue. Need to look at what went wrong with the current situation with profit for insurance companies. You know, we knew, our organization knew this was in big trouble back in July and August. And we saw what was coming, and we were very concerned about it. And when we asked those questions, and when we make this conversion, and we have a number, you know, for example, when you look at the Blue Cross Blue Shield, when they're looking at $1.5 billion in reserves, and the first piece that came out as we're talking about this issue was the concern about the profitability of the insurance companies. And the real first issue of concern should have been about the people and the health care for people in the state of Minnesota. That should have been the first concern. And so it shows we sort of have a failed model, I believe. But barring that, I think it's important that when you look again at the issue of getting rid of the nonprofit status, you have to ask some other questions. For example, that $1.5 billion of reserves that, for example, just Blue Cross Blue Shield holds, and you have other companies that are holding reserves, you know, other terminology is profit, but those are the reserves. Those reserves come from the people's premiums in this state. They also come from public programs like Minnesota Care and other, those dollars, you know, are they just going to float into for-profit insurance? I think that's a tough question, needs to be addressed. And again, I appreciate Senator Benson looking at reform that you're looking at and considering and moving forward. I know that you have been involved with the Healthcare Finance Task Force report in this state. I would hope that as you look at reform, you look at some of those recommendations. That was a bipartisan task force, was put together by the governor with appointments from both sides of the aisle. I think you should examine some of those recommendations. I think there's merit in looking at, for example, the ag cooperative idea. And when you look at the reinsurance piece, I think you need to look and ask some tough questions about how that risk is shared if you're going to do something along that order. So again, I appreciate the opportunity to testify. Senator Ames, thank you for the work that you're doing in leading on this effort.
Thank you, Mr. Sobocinski. Mr. Connie?
Good morning. I'm James Connie. I'm a dairy farmer. I guess all I represent are farmers and small business people across the state, in that I've talked to a lot of people in the last few months who have had a lot of problems paying for their health insurance. And as an individual, my rates went up to double in this last year, went from $500 to over $1,000 per month for an individual. I was able to, going through MNsure, to get a reduced rate, but some of my neighbors and a lot of small business people are not able to access that because their income happens to be over the cliff. And as such, they are in big trouble. They're spending a percent of their income that is not sustainable to continue in business. And as such, I think they need relief, and they need relief now. And what I've been hearing, I was over in the House area earlier today, is that there are basically two things going on here. One, relief for individuals, and the other is reform. And I would hope that you will not throw the relief out because you can't do the reform. And on the other hand, I would say that I would hope that we would get relief even if we have to postpone reform. In other words, as a farmer, I look at how I run my operation. And what I look at is that I have various enterprises. I have my dairy, I have my beef, I have my crops. And not every enterprise makes money every year. And just because one area is losing money doesn't mean that I quit farming. And just because a insurance company loses money on one sector, 5%, they're making money on the rest. Why should they be burdening that one sector? And the other part, as far as moving forward here, as far as getting relief, as a farmer, I know neighbors that sell their pigs, and if they put onto that truck pigs that would void the load, they get docked for the whole load. I ask you to keep this a clean bill, keep it as relief, so that you don't get docked in the long run by a bill that cannot fly through the whole process. Thank you.
Thank you, Mr. Connie. Any questions for Mr. Sobocinski or Mr. Connie? Seeing none, thank you, gentlemen.
Thank you.
And I know I'm probably not going to pronounce this right. Mr. Grotz, come up, please.
Mr. Chair, is that a person that was on this list?
Correct. What's that, Mr. Senator Hayden? I'm sorry, I missed your question.
Oh, I was just trying to follow in line. It looks like we went out of order.
Yes, I did.
I'm just trying to follow in line.
Because I wanted these two gentlemen to come up together because I think they may have rode together. I'm not sure.
Thank you, Mr. Chair.
Thank you. Thank you for bringing that up. And sorry, sir, would you state your name and who you represent for the record, please?
My name is Jim Grotz, and I'm here representing myself as a private individual. And my wife and I have been self-employed small business for almost 30 years, and we have been put through this torture for many years. Our Minnesota health insurance market for individuals is broken. I'm in favor of this idea of premium relief. However, I cannot support the idea of taking the reserves from the Minnesota reserves. I feel this should be coming from the reserves of the health plan. You've all heard from the health plans and their lobbyists. They claim they're losing lots and lots and lots of money. And I am one of a handful of individuals in this state that have taken the time, gone to the effort over many years to go through the financial statements, the tax returns, and the NEIC annual statements of these Big Four health plans for the last 10 years. Unfortunately, these financial statements tell a different tale as being told by the healthcare lobbyists. This is an embarrassment of riches. And I'm pleased that Senator Benson is bringing this forward to try to get something going. But our system is broken. We need a total change. We need to look carefully and examine carefully the reserves of these health plans. We would not be in this mess if we would just had used some simple common sense as individuals. When Girl Scouts sell cookies, they are held to high standards, including audits and following generally accepted accounting principles. However, and I'd like to show this comparison, we have Girl Scouts, they're held accountable on a $4 box of cookies, they're audited. And we have the health plans in this state alone are getting over $5 billion from us as taxpayers. There's no audits, and they are not following accepted accounting principles. As a result, this is all about hiding money, and it's very embarrassing. I'm embarrassed as a resident of the state. I'm sitting here with some selected pages from financial statements from one of the larger health plans. There are pages and pages and pages here of significant variances from generally accepted accounting principles. Now, why is this important? I'm from the financial services business, and if any New York Stock Exchange company comes along and says, oh, we now have this qualified variance and this qualified opinion on our financial statements that we've got a little problem here and we can't answer this, suddenly the death spiral begins of the stock price. It just goes down and down and down and down. We've got pages and pages of variances here, and no one seems to be interested. This is a serious problem. I have had issues with this for some time, and no one has seemed to care at the regulatory authorities. And in closing, I would like to state this to you. As individuals and small business people, we have been treated by this HMO monopoly, and that's exactly what we've got. I would like to state this to you. This is our livelihood. We can't make it unless we do a total reform of this insurance market. Greater Minnesota, the viability of Greater Minnesota is questioned here. They can't make it. We've been segregated out as small business and self-employed people. I would urge you to continue to look at this and look at other alternatives, including forcing of merged markets. We have a short-term problem, but we also have a long-term problem. We have to address both. And I would urge you to continue to look at solutions. And again, I would like to thank Senator Benson for bringing this forth as a start to start talking about this narrative of what must be done. We have these 4 major health plans that claim to be nonprofit. I think we're going to have to think about what it really means to be nonprofit. Thank you, Mr. Chairman.
Thank you, Mr. Groats. Any questions for the testifier? Thank you, sir. We do appreciate it. It's now 12 o'clock. We are going to call a recess. We will come back at the call of the chair. It'll be sometime this evening, probably between 6 and 7 o'clock. And so at that point in time, we will have MMB and the commissioner from the Commerce testify. They can come in and testify at that point, and then we will move forward from there. Thank you, gentlemen. Thank you, committee. And we will catch you at the call of the chair somewhere between 6 and 7 o'clock in room 1100 this evening.